Hi, welcome to Mindscape Matters, and I'm your host, Dr. Mohan Raj, a consultant psychiatrist. Let us look at the treatment options for obsessive compulsive disorders in the next few episodes. The usual first line of treatment for OCD is either medicines or cognitive behavioral therapy or a combination of both. Research evidence shows that medicines or cognitive behavioral therapy is effective in many people, and when they are combined together, the effectiveness is much more than when they are used alone. Today, let us look at a specific type of cognitive behavioral therapy called exposure and response prevention, shortly known as ERP. Now, I have a disclaimer here. These videos are for the purpose of education and increasing awareness. This is not a substitute to treatment. Please visit your local psychiatrist in your town, city, country and follow his or her advice. ERP is exposure and response prevention. The exposure in ERP means exposing the person to the object, person, situation, activity, or a thought that acts as a stimuli in triggering an obsessive thought. And the response is usually a compulsive act. That's what we are trying to prevent. Let's look at an example. A shop has a door handle, and one of the staff has to open it often. And this person has an obsession that whenever he touches the door handle, he has an obsession about dirt and contamination. And this obsession makes the person very anxious. And the only way he has learned to control the anxiety is by washing his hands. And if his job requires handling the door handle many times a day, this person will be seen washing the hands many times a day to keep the anxiety under control. In ERP, the person is exposed to the stimuli. In this example, the door handle. So the exposure could mean looking at the door handle or touching it for a short period or touching it for a prolonged period. This can cause intense anxiety. So usually, before ERP is started, the person is trained in relaxation techniques. There are many relaxation techniques. There are breathing techniques. There are progressive muscular relaxation techniques. There are imageries. We will look at relaxation in a separate episode later. The exposure of the trigger, in this case, touching the door handle, causes intense anxiety, and the therapist encourages the person to practice relaxation techniques to bring down the anxiety. Now, the second part of ERP refers to response prevention. The usual response is washing to bring down the anxiety. So here the therapist encourages the person to avoid washing or at least postpone washing as much as possible. Now, this again causes a lot of anxiety because the person is used to washing. Now, when the person is not washing, that is, the response is prevented, the anxiety goes up. Here again, the relaxation techniques help in bringing down the anxiety. As the nature of obsessions and compulsions are widely varied, you can imagine that the exposure and response prevention is also very, very varied, depending on the person's unique obsessions and compulsions. The psychiatrist or the therapist will discuss with the patient, and together they will formulate what kind of exposure can be planned and what kind of response prevention can be planned. When it comes to exposure, the best option would be graded exposure. Graded exposure means start with an exposure which causes the least amount of anxiety. Say, causing anxiety of 1 to 2 points on a 1 to 10 scale. So once the person is exposed to that stimuli which causes least amount of anxiety and the person overcomes that anxiety, Then we can expose them to stimuli which causes say 3 to 4 points in a 10-point scale. Similarly, we can go up to 5 to 6, 7 to 8 and 9 to 10 as we go by. I have done a video on exposure and anxiety in an earlier video, and I'll give the link in the description and you can watch to understand graded exposure better. Similarly, response prevention can also be planned in a graded manner. They can start with a level where the person is comfortable. Like, can you avoid washing for 1 minute? And once they are able to do it, can you avoid washing for 2 minutes, 5 minutes, and gradually increase the time that they can prevent the response. Let us look at another example. There are people who may not have a stimuli or a trigger. They could just have an obsession. For example, there are people who have a compulsive urge to touch an object like say a phone or a table 3 times or multiples of 3 times. And the obsessive thought that accompanies is, if I don't touch my phone 3 times, something very bad will happen to my parents. So they are yielding to the compulsion because they want to avoid danger to their parents. So if I don't touch, I become intensely anxious, something is going to happen, and when I can actually prevent danger by touching 3 times, why not do it? And they yield. Here, ERP is planned this way. The exposure is exposure to the thought. The response prevention is preventing touching it. Like, don't touch as much as you can. 1 minute, 2 minutes, 5 minutes. And while you don't touch, the anxiety goes up, but use relaxation techniques to bring your anxiety down. And when your anxiety goes up, that is your exposure. Exposure to anxiety and staying with the anxiety is the exposure here. Now, by doing this, their anxiety for the thought as well as the urge to touch also will gradually come down. As I mentioned earlier, the ERP is different for different persons based on their unique symptoms, and this is planned in collaboration with the person themselves. What if a person has only obsessions and no compulsions? Here, ERP has a very limited value. For such situations, there is a different CBT technique called audio exposure. Let us look at audio exposure in detail in the next episode. Thank you for staying this far. If you like this video, please tell 4 of your friends who might benefit. Tell them there is a Tamil version of the same video. Stay tuned because Mindscape matters. Bye.